Hello everyone, welcome back to my channel. So most of you are aware of the disease which I will be discussing in this video today because it is a very common autoimmune disease. In Urdu we also say those people Surajmukhi because they are all white. Their hair are also white. They they are very light skin, like the original skin tone of Asians is usually whitish, but they are very lighter than that. So that disease which we will be discussing today in this video is vitiligo. So basically I will tell you what vitiligo is, what are the causes, and what can be the symptoms of vitiligo and the treatment, and whether it is treatable or it does not. So yeah, we will discuss everything in this video, so keep on watching this video till end and you will find out all the answers to your questions. So vitiligo is a autoimmune disease. Like autoimmune disease is that in which your normal body cells which attack and other body cells, like within your body they attack normal other body cells. In vitiligo, your cells attack melanocyte cells which produce pigment in your skin, which give your skin a color. They attack those cells due to which we can lose the color of our skin. We become very white. Similarly, in vitiligo, it happens that our skin becomes very pale white, like a vampire skin, very pale, because we lose the melanocytes which produce the pigments which give our skin. So yeah, what can be the causes of vitiligo we will discuss in this video. um so yeah, let's start this video. Yeah, so number one cause of this disease is that it is an autoimmune disorder. So it will automatically attack the melanocytes, and it will destroy those cells, and we will lose the cells which produce pigment in our skin. Number two is that the other cause is that it can be genetic, like it runs in your family. The vitiligo disease runs in your family. Maybe your grandparents have it, or your maternal side family has, or your paternal side family. Anyone can have, and you can inherit from them. Number three is that it can be triggered by the stress. Like, let the stress be physical or emotional stress. Like, if a person is physically exhausted, it can trigger vitiligo. It can be in anyone, not necessarily there's a selective person who has a history of vitiligo. It can happen in anyone who does not have a history of vitiligo. The stress can trigger in anyone. Emotional stress, like a person is depressed or it is tensed, it can be also triggered in that person. So number four is it can be triggered by the chemicals. Chemicals can be phenols or catechol, like anything. Number five is if you have vitamin deficiency. Those vitamins which cause vitiligo, if they are deficient, are vitamin B12. If that is deficient, or vitamin D, that can trigger vitiligo. Okay, so now we will discuss the symptoms of vitiligo. The symptoms can vary in every patient. Not necessarily they are same, they can vary patient to patient. So number one is that first, the most primary symptom is that we notice white patches, which is the very first symptoms. We can notice white patches anywhere on our body, like those patches which are very different from our skin color, that we can totally recognize that there is something wrong going on in our body. They are totally very white. So we can easily rule out that this is a start of vitiligo, an autoimmune disease which can happen to anyone. Number two is that some people can notice itching or burning in the affected areas. This itching or burning sensation they have never experienced before, which they will experience in the patches they are which are occurring on their body for the very first time. Number three is that, as I told you, that the symptoms can vary patient to patient. So number three, in some patients, the hair of the affected area they also turn white. Like it is not common in every patient, but it can in some patients. There are some cases which complain of whitening of hair of the affected side. So now let's discuss the treatment. But before discussing the treatment, let me tell you a fact that no matter how many treatments you take, if once vitiligo starts, it will never go back to normal, but it will spread throughout your body. It can take some time, a lot of time, in fact, many years it can take to spread evenly over all your body. But with medicines, we can reduce the side effects like inflammation, the burning sensations, or the itching. We cannot reverse the uh, color changes it is causing. So yeah, number one is topical corticosteroids. Corticosteroids, which are available over the counter or prescribed by any of your dermatologist, like they can only soothe your inflammation and your itching sensations. So most of the time doctors only recommend corticosteroids to minimize the symptoms which a patient is facing, like irritation, itching, inflammation, burning sensations. These are the symptoms which can be minimized by the use of corticosteroids. Number two is topical immunomodulators. Immunomodulators are the ointments which modify the immune system response. So they are helpful. Again, I told you they are helpful in minimizing the symptoms only. Light therapy, like exposing yourself to different wavelength of lights, it can help to restore your skin pigmentation, but it is not a guaranteed process. Like not 100% surety is given to a patient, but for their satisfaction, they can go for this process. Number four, in some areas, if people are not feeling very confident about their new look, like they are having a large patch somewhere which is very visible, so they always have an option to go for skin grafting. Very few percentage of people will consider this as option, but if for their own confidence, for their own well-being, if they want to go for this option, they are not satisfied with a very large patch which is showing up and which is affecting their confidence, then we always have an option of skin grafting for them. Number five is vitiligo surgery, which we transfer melanocytes into the body so that the skin pigmentation can be restored. So this is also one option which is offered to the patients. Number six is that there are some home remedies which like minimize the symptoms, which can be turmeric, ginger. They just minimize the symptoms, the inflammation or the burning sensations which a person is feeling. They minimize it. And the last one is counseling. Like counseling of a patient going through this disease is very, very important. It plays a very vital role because in this disease, people lose their confidence. They are not confident enough to show themselves to the world, and the thing which is going inside their body, they are not confident enough to expose. So for that, counseling is very, very important for them because for the well-being. because vitiligo can have a significant emotional impact on one if they are facing this disease. So yeah, counseling and therapy is always a number one choice. We can suggest any medicines to them, but to have an emotional support, it is extremely very important because it can take 10 to 12 years to spread throughout your body. It is a very slow process, and through all those 10 to 12 years, a person will think that his life or her life is over, like they have zero self confidence. So counseling should be doctors' very first choice even before giving them medicines. Like they should counsel a patient that you should accept your skin and the process your skin is going through. It is not forever, but it will take few years, and then you will get your new skin, which not everyone has to go through, or not everyone can face it. You are unique in all those. So these kind of counseling a person needs to boost their self confidence. So yeah, that's all for today. If you found my video helpful, please do comment on my video below, and do mention which topic I should talk about next, and I will definitely try to make a video on that topic, and I will try to cover all your points and all your questions. Thank you. Till then, bye.